Mark. Repeat
Yes.
chest.
Chest.
Chest. Chest. Chest.
Okay,
Well,
got a chest for Miss Parker. Will you set up the room for me, first year?
Yes.
Mrs. Parker,
It's me.
right this way. This is Jillian, one of our first year students.
Did you check your wristband?
What's a wristband?
I'll do it. Can I see your wristband? Yep. What's your name and birthday?
Elizabeth Parker, August 8th, 1992.
Okay, sounds good.
Right this way. All right, Miss Parker, step up to the board for me.
Mark, she's pregnant. Shouldn't you put a shield around her?
You're a first year. Second years don't put shields on them.
I'm 6 months pregnant. I really want to know what's going to happen to my baby.
Let me get someone to explain it to you in layman's terms. Be right back.
obviously you can tell that Mark the spaz doesn't know what the heck he's doing. First, he should have went to the patient, asked if the patient was pregnant, and also checked her armband. Simple newbie mistake.
Mystee, will you please finish this exam for me, please? The lady's got a bad attitude. I think she's pregnant or something.
Mark, you can't just leave a patient in the room by themselves. I'm going to help you with the exam, but I'm not going to do it for you. Let's go.
Okay.
Hi there.
Hi,
I heard that you have some questions for us. Do you want me to call down the radiologist and he can answer them in detail?
that'd be great.
So what's,
This is the radiologist.
hey, how you doing? Mr. Learn. I pronounce learn. So you're pregnant.
Yep,
How far along are you?
6 months.
And you have some questions, huh?
Yeah.
Well, here's an information packet for you. That maybe some of your questions may be answered, but if not, I'll be here more than happy to answer them for you.
Okay. Is this safe for my baby to get this X-ray?
It is, but what we're gonna do is we're gonna shield you with some lead. All right? And that'll stop any of the radiation to get to your fetus.
Okay. Is it going to do, like, have any harmful effects on my baby, or?
Well, if you can look at a chest x-ray, that's what you're here for, correct?
Yeah.
Chest x-ray? Roughly, it's like spending 10 days out in the sun.
Okay.
So the minimal risk is, to any changes to your fetus is very minimal.
Alright.
Okay, any other questions?
I don't think so.
No, is Dad around, or is Dad here for the procedure, or if he has any questions?
He's out in the hall.
There is no Dad? No? You always out there?
Yeah.
Okay. Sounds
Yeah.
good. Any other questions you might have?
Nope. I think that's it.
Sounds good.
Thank you.
All right, go for it.
Misty's gonna get you a shield, so go ahead and stand up, and we're gonna go to the board.
All right, ladies. I'm just going to wrap this around you. And it's really heavy. All right. Jillian, you can go ahead and take over.
Okay. Go ahead and put your chest against the board. This is gonna raise up a little. Keep the light. Go ahead and roll your shoulders. ahead and take a deep breath in and hold it. You can breathe. Now I'm going to have you face me.
No, we're only going to do the one view.
Okay.
So often patients have questions that us as technologists, we have to relate in terms that they can understand. Well, that's why they came up with the BERT method, which is the background equivalence radiation time. B.D. Wall in 1988 set certain factors that would help us inform the patients as to what the dosage would be comparable to what they're used to experiencing in the outdoor life. Like what situation with the chest x-ray. B.D. Wall had said that it's approximately 10 days of sun. Now there are other categories like a lumbar spine, which is probably 6 days, cervical spine, all different modalities and x-rays exams that we'll do relates to what we can possibly tell the patient as to what they've experienced in their lifetime.
Hello, Miss Felicia.
Hello.
Hello. What brings you in the ER today?
They think I might have kidney stones.
Really?
Yeah.
Well, let me go ahead and lay you down.
Mark, should you ask if she's pregnant? She's only 21.
We only ask between 15 and 18 years.
Mystee, he's doing it again.
If I am pregnant, is this safe?
Oh yeah, it's real safe for me because I'm going to be behind that shielded barrier over there. I'll show you.
Most hospitals, their policy on pregnancy is from the ages of 13 to 55. A lot of the exams that come in, we have to ask the patient if they are pregnant. If they are unclear if they are pregnant, we need to do a benefit versus risk analysis, and it's usually the doctor's determination with that. If it turns out that the patient is pregnant, there is a set protocol that we have the patient fill out. We ourselves as technologists have to enter information as far as what technique that we used, what type of room, whether it be a single phase or a 3-phase unit, the technical factors that we actually plugged into the computer to get the image for the patient. All that will be evaluated through our radiation physicist.
Hi, Miss Felicia.
Hi.
Hi. I heard that you don't know if you're pregnant or not.
Yeah, I don't know.
Okay, well, what we're going to do is we're going to call the doctor, and he's going to let me know what we should do, okay?
Okay.
Stop it. Hey, Doc, I have a question for you.
Hey, what's up?
We have a pregnant patient down here in the ER, well, possible pregnant patient. She's not quite sure. She's here for an abdominal x-ray. What do you think we should do?
Okay, well, how old is she?
She's 21.
21. When was the last menstrual period?
She said she's a little bit overdue.
Overdue?
Yeah.
Okay, well, what's the reason on the rec?
Kidney
What's the reason
stones.
for the x-ray?
They think she has kidney stones. She's having a lot of pain.
Okay, well, if necessary that we get the entire film, we need to make sure that we do shield the patient, but we do have to get complete from diaphragm to pubic symphysis on the film. So, safety technique factors, write them down, have the patient informed that we need to get this x-ray completed. And then if you have any questions, just give me a call.
All right, sounds good. Thanks.
Sounds good.
Bye.
Oh, boy.
Felicia.
Hi.
Hi. So I called the doctor, and we're going to go ahead and do the x-ray since we don't know if you have kidney stones or not, and that's really the only way to find out.
Okay.
So I'm going to have one of the students come in, and she's going to do the x-ray, and hopefully we find out what's going on.
Are you sure it's safe for me?
There's minimal risks. We don't know. We're still going to shield you from the upper part of your belly up. That way, you know, in case you do end up wanting to breastfeed or something, it's not going to harm anything.
Okay.
But other than that, that's the only type of shielding that we can do. Is that okay?
Yeah, that's fine.
Okay. Would you mind signing something for us stating that we explained the risks to you?
Okay.
All right. Thanks.
Okay, I'm ready. Okay, I'm gonna have you lay down now. Gonna put the shield on you. Go ahead and take a deep breath in, blow it out, and hold it out. You can breathe.